Welcome back to the Developing Values and Principles in Health and Social Care Practice. I will now be explaining the care certificate. A bit of background information regarding the care certificate. So this was introduced, as mentioned on the slide, in April 2015. This was following the failings of the Mid Staffordshire NHS Trust. A YouTube link has been provided to emphasise on what has happened in this case. However, to summarise the events of this case, regulators operating notified how there was appalling standards of care which had been reported, leading to 400 more deaths than usual. Upon their failures, one of the key findings which were noted was that there was an inexperienced nurses and in some cases receptionists assessing to patients. This then led to a huge inquiry which discovered the importance of having a consistent and caring approach within workplace settings. Following this, it led to the introduction of the care certificate. Moving on to our next slide. What is the care certificate? A care certificate takes into account 15 compulsory standards. Some of these relate to the codes of conduct, the social care commitment, and also the 6 Cs. The care certificate ensures that all health and social care workers have the required skills and knowledge to work with vulnerable individuals. However, it does not substitute the importance of having workplace induction or workplace training. The 6 Cs are an additional value in health and social care. This focuses on 6 key elements which are required to maintain and support service users. They go by the following: care, compassion, competence, communication, courage, and commitment. Who does the care certificate apply to? Overall, the care certificate applies to all individuals working with vulnerable people. So this could be new staff across the health and social care sectors, or it can be individuals who have direct contact with vulnerable individuals. Moving on, the purpose of this certificate is to identify and understand the focal knowledge aspects of how a service provider could ensure that they are meeting a service user's needs. It allows them to have practical hands-on training whilst also having a workplace assessment through the use of the care certificate. How is this assessed? So this is usually assessed prior to working with vulnerable individuals. Therefore, service providers would have to ensure that they have each standard of their care certificate complete before they are able to work independently with a service user. Having said this, if a service provider is currently undergoing their care certificate, they are able to work with service users. However, there would have to be another individual who has their care certificate complete with them. Next, we have some key terminology. This is here to help you understand some key words to be mindful of when you are doing your care certificate, as you may be asked to do some of the following, such as demonstrate. You may be asked to demonstrate how you could apply one of the standards of the care certificate to your practice. You may then be asked, for example, to describe what it means to demonstrate one of these standards. You may then be asked to list down. This will then refer to you identifying and writing down main points. And this could also lead to you explaining something, such as explaining a certain standard. Lastly, we are now moving on to the 15 specified standards. These are all the 15 standards which you will be assessed on when you are doing your care certificate. You will have to complete an assessment based upon these. The first standard is understanding your role. The second would be your personal development. The third would be duty of care. Equality and diversity, person-centered values, communication, privacy and dignity, fluids and nutrition, awareness of mental health, dementia and learning disabilities. Your 10th standard would be safeguarding adults. Your 11th standard would be safeguarding children, basic life support, health and safety, handling information, and infection prevention and control. Okay, so these are all of the 15 standards which will be covered within the care certificate. You would have to show great subject knowledge in regards to each standard in order for you to attain a certificate overall. To summarize, this follows up on our last slide in regards to the care certificate. Thank you for listening.